Well, good morning, everyone. Glad to be here with you today. My name is Ruchelle Pride, and I have the pleasure of serving as a director for our Franklin County Board of Commissioners Office of Justice Policy and Programs, as well as our court-appointed special advocates of Franklin County. And I will allow my team to introduce themselves before we dive in.
Good morning. My name is Newsome. I am the Social Service Administrator with the Office of Justice Policy and Programs.
And good morning. I'm Melissa Pierson. I'm the Chief Operating Officer with the same office.
So we're excited to talk to you about our work in reentry, as it is one of our largest pillars, our greatest investment in the work that we do for our residents. Just so you have an overview of who we are and kind of what our office does. We are the criminal justice planning agency to our Franklin County Board of Commissioners and Criminal Justice Planning Board, as well as our county administration for Franklin County, Ohio. Our population is about 1.3 million people and counting. And so we are responsible to effectuate the fiduciary responsibility of allocating federal, state, and local dollars to our justice ecosystem, as well as our community partners. We strategically plan, we consult, we offer technical assistance for many projects. If there's something going on related to justice and effectuating it in the proper way, we're probably somewhere involved in the corner or in the ceiling. So we're really happy about that, but the biggest piece of it is our work that we are able to do through a lens, first of all, of race, equity, and inclusion, and understanding truly that how you see people is how you serve them. And so it is on us to make sure that our vision remains 2020 in the population that we serve. But we cannot do this work without our collective partnerships and without our system stakeholders. Our sheriff's office, all of our different municipalities within our Franklin County family. In addition to the different sectors, this work would not be possible without that collaborative engagement and impact throughout. And so what we want to be able to talk to you about today is how our work has spearheaded so many different opportunities for us to put individuals in a position where they are able to thrive and not just survive, as our Commissioner Erica Crawley likes to say, because that truly is what the goal of the work that we do is, ensuring that we are putting people ahead of the curve, not at the curve or behind it, but that we're setting them up for success, and we're serving the whole person and those family members and other community partners that are connected to them. And so our rapid resource centers are something that has really been a baby of all of ours since inception. Back in 2021, we opened the Rapid Resource Center at our Franklin County Jackson Pike Jail facility. And what we were excited about in being able to do something like that, which we will expound on, is truly the definition of meeting people where they are. A resident can get released out of one door and walk into our door and be able to get everything from a hot cup of coffee to linkage to service. Whatever that looks like, we wanted to make sure that the whole person was being served and that we were addressing all social determinants of health that we know that impact all of us in this room, and definitely impacts the people that we serve. Our commissioners have been uberly grateful. I might get in trouble because I feel like I keep asking for a lot of money, but as he talked about, we know what investments look like when it comes to jails and reentry, and they have certainly led the charge. They have certainly supported us, in addition to our county administration, in really creating a model that is now nationally recognized. We all collectively in our respective spaces serve on a lot of different national and state committees to, again, continue to advise, to continue to benchmark, to continue to glean best practices and how we are able to do this each and every day. So when we began the Rapid Resource Center, we were able to carve out a space that my team members will get into a little bit more, because they certainly are in the weeds of it each and every day. And I always say that there is no me without this team that we have. We cannot, no one person, no one entity can do this work alone, and we've been blessed to have a team that has been able to forge that. And due to the success of our first Rapid Resource Center, and we'll get into some of the data and the numbers of what that success has looked like, we then began to, as we took a tour, as was mentioned earlier, we have a brand new jail that is online and that we are slowly moving some things into. We have shut down our downtown jail facility. Our downtown jail facility needed to be shut down, so we were grateful for that advancement. And so that left us with the jail that is, again, on Jackson Pike, but as well as our new James A. Carnes Correctional Facility. And so we, of course, are in transition with our residents from one facility to the other. But in the curation of that facility, which is also a state-of-the-art facility that has been nationally recognized, and we've had a lot of people, even internationally, come and tour our jail. The one thing is that we understood that continuity of care is important, and equity and access is also important. So 9 years ago, when that jail was being developed and designed and working with all of the people to make it possible, the Rapid Resource Center was not a thing, and we understood that. And so while we were taking a tour back in 2021 of the new jail facility as it was getting ready to prepare to open, I say that me and Ryan were on a covert mission. I'm blaming him for why I ended up asking for more money again, but it was absolutely necessary to do. As we were walking through the jail, we were looking for a space, a dedicated space, an intentional space, a larger space for another Rapid Resource Center to come online. And so again, not that they excluded us, it just wasn't something that was in the wheelhouse when it was being developed, but we found a wall that could be knocked out to build out a brand new Rapid Resource Center. And about 1.5 years later, and about an additional $3 million plus investment, we were able to bring about a second Rapid Resource Center in operation with our existing Rapid Resource Center. And so with that being said, I know you guys are eager to hear about the what, the when, the how, and the who. And I want to turn it over to Melissa and Ryan to be able to talk to you about some of the data points that we have, what we've seen with our Rapid Resource Centers, lessons learned, and things that we want to organically involve into. Because in reading an article that Melissa actually shared with some of our stakeholders the other day, with our Criminal Justice Planning Board, and we also oversee our Reentry Advisory Board, it talked about reentry begins at entry. My perspective is that the best reentry is no entry at all. And so the goal is to how do we eventually move things more upstream, right, to where we can be more preventative, that we can also intervene when we need to, and in the cases where we respond, we do so. So Melissa, with that being said, I'll tee it over to you to talk about our Rapid Resource Centers.
Thank you so much, Director Pride, and thanks everyone for being here today, and a special thank you to Justice Stratton for inviting us. We love to talk about our Rapid Resource Center. We could talk for hours and hours. I promise we will not. We'll give you the highlights, get you a little bit curious about it, and then also invite any of you that want to come take an actual tour, because to see it is to really understand it a little bit better. But let's talk about why we needed a Rapid Resource Center. Well, to do that, I need to give you a little bit of context. What is Franklin County? Well, Andy, we are 1.3 million,
Yes.
14th largest city, Columbus, in the country. We're a lot bigger than people, I think, actually realize. So we needed to be responsive to the population that was coming into our jail. Our jail, average daily population pre-COVID was right around 2,100. Now, we haven't gone back to that number post-COVID, but we're slowly creeping back up. We actually were able to get it down to about 1,350, but now we're actually hovering at that 1,700 mark, and unfortunately, we keep seeing it go up month after month. So, back in 2021, what were we dealing with? Well, we were dealing with a pandemic, so we thought, well, that's the best time to start a new program, right? But we were also dealing we were really embedded in the opioid epidemic, which we all know, we don't even call it an opioid epidemic anymore. We call it an overdose crisis, because why? Fentanyl's in everything now. We needed to be more responsive. I'll tell you, I heard a sheriff out of Middlesex, Massachusetts say this, and it's stuck with me ever since. He said, Melissa, vision without data is just a hallucination. And I thought, God, that makes sense.
It does.
And so we knew we needed to really prove our point. Why? Because we needed to get some space in the jail. And the Jackson Pike jail, if you've ever been there is no space. Space is at such a premium, hence why we have a brand new jail online. But at that time, we didn't have that option. And every little corner of that jail was being used for something. We needed a space to be able to do some additional programming. And so I want to start with a data study we did very early on. And one thing I really recommend, and I'm going to stand up if you don't mind. One thing we did very early on was to prove a point that we already all knew in our guts. We all knew we were working with the justice-involved population, and they were some of the most at risk for overdose and death. We all knew that, you all knew that sitting in this room, but we didn't necessarily have the data. We had national proxy data, but in Franklin County, we like local data. We like state data. So what we did is we reached out to our coroner's office, and we actually did this first study in 2017. We've done it every other year since. So in 2017, what you're seeing up here is the 2021 data, but in 2017 data, we asked the coroner for every single overdose death that happened in Franklin County. We were provided that data. We took that data and overlaid it with our jail management system. And you know what we found is exactly what our guts told us. We are working with, in fact, the most at-risk population. In fact, in 2017, close to 25% of the individuals that died in 2017 were in our jail the 12 months preceding. I'm going to say that again because I really want you to let that sink in. In 2017, every single overdose death in Franklin County, 1 out of every 4 of those individuals that died were in our jail the 12 months preceding their death. We took that data and we extrapolated it as many ways as we could. I could tell you how many were in our jail six months prior to their death, 4 weeks prior to their death, but I'm just beating that drum. The point is this: we know we're working with the most at-risk population, and this data confirmed it. Why is that important? Again, we need to talk about actual data to prove the worth and the merit for why we need some of these programs. Here's another data nugget for you. In 1999, if you were to look at our jail population, what you would see is that 90% of the individuals in our jail were misdemeanors on pretrial charges. Well, we've done a really good job at flipping that script. We've done exactly what we knew we needed to do. If you look at our jail profile today, it's 90% felony pretrial. We have very few misdemeanors in our jail today. And that's a good thing, right? We got the people that we're mad at out of the jail. We've kept the people we're scared of in our jail, and that's who sits in our jail today. The problem, though, is 70% of the individuals that get booked into our jail are out within 3 days. So how do you take that data and marry it up with the fact that we know we're working with the most at-risk population? How do we use that window of opportunity while they are in our jail? Because that's how we see it. It's an opportunity. But in 72 hours, we're not miracle workers. So what we had to do is figure out another way. We had to jump outside of that box we're used to working in. So we went to Chief Stobart, we went to the sheriff, and we said, we need to get our arms around these individuals that are processing in and out so quickly that we cannot offer the services that we know many do want and so many could benefit from. So what did we do? We walked around that jail. We walked around that jail and we said, give us a closet if you have it. Because what we wanted to do was create an exit through the gift shop model where individuals, as they were being released, were walking by this beautiful room, and that's all it is over at Jackson Pike. It's just a room, and it really was used as a closet. They really, that when dry cleaning came in, guess where it went? It went to this room. We said, give it to us. Let us have it. It's in the non-secured part of the facility. So as individuals are released, now it's not quite an exit through the gift shop like the one at the new jail is, but it's there. So when individuals are released, they know they can go to this room. They can get anything from a cup of coffee all the way to get linked to treatment. And Ryan will go into those actual services here in a minute. We wanted to make it easy for people. We wanted to transport people to their next best location. We're not located on a bus line. And from talking to jails across the state, there's a lot of other jails that are in the same boat. They're not located on a bus line. So we knew we needed to figure out, well, how do we get people to their next best location safely? And we'll talk about that a little bit too. So the Rapid Resource Center really was intended to be a fast track into treatment, but then there's all these other needs that we know individuals have. And our Deputy County Administrator, Joy Bivens, likes to say this. She really likes sandwiches, and she always talks about peanut butter and jelly sandwiches. And she says, I don't go to Kroger for my peanut butter, and then fly over to Giant Eagle for my jelly, and then go off to Aldi for my bread. We don't do that. And the people we work with shouldn't be expected to crisscross the county for all these services we know that they need. We want to set people up for success. No matter what your philosophy is, we want to set people up for success. We don't want them back in the jail. We don't want them going further into the criminal justice system. We also know people with a mental health diagnosis, they come back to us more frequently and they stay a lot longer. So what can we do a little bit differently to make sure we're linking people as soon as they get out of the jail to services? Now I'll tell you this. Not everybody takes us up on our offer, but we plant a heck of a lot of seeds. And I really am very confident that we are making a difference. So now that I've wet your palate, I want you to hear a little bit more from the guy himself who actually is putting these programs into place in both of our jail settings. Brian? And you can click forward maybe one.
That's it.
There you
Yes.
go.
Good morning again. My name is Ryan Newsome, Social Service Administrator. I just want to talk a little bit about our operations of the Rapid Resource Center. You have the visual services as well as some stats. So again, we're located at the Jackson Pike Jail. That's our first location. Our second location is at the new James A. Carn location of the new jail. In 2021, we started at Jackson Pike. We started out at just one shift. We started day shift, 8 to 5. We realized that that wasn't enough. Like the sheriff officer would tell us, they released 24/7. So notwithstanding the funding that wasn't available, we want to reach out and try to extend our hours. So currently, happily to say that we are actually 24 hours a day, 6 days a week. So that means that anyone who's being released during those 6 days, and I'll get to the 7th day in a minute, can stop into the Resource Center and pick up the services that Melissa and Director Pryor talked about. On the Sunday, which is the 7th day, the data doesn't support being open 24 hours a day, but it does allow us to be open at least 8 to 5 to provide those services. So I'm going to kind of talk about also the makeup of the Rapid Resource Center. So we do have county staff members there for those hours. We also have partner agency staff, and they're definitely looking to increase their presence in the Rapid Resource Center once we get to the new space, because like Melissa talked about, the space at Jackson Pike is kind of a closet, but it's functional. It's a functional closet. The most important thing we want to do is have a space that individuals can come in and receive services. Another thing that we kind of want to focus on is the location. What I mean by that is the location where people are being released compared to our location with the Rapid Resource Center. I'll talk a little bit more about that when we get to the new jail. As you can see, a new Rapid Resource Center at the new jail, which is more of the model that we wanted to do as far as the gift shop model. So services. So as you can see, we in about a year's time, we had 9,469 walk-ins. Very impressive. I will admit the hard linkages to care. 143. I would love to see that number in the thousands. And I'll talk about our future plans to increase those linkages. I'll talk about that as well. And then, of course, the in-reach visits and soft linkages. You can see those numbers. Well, one thing I would like to mention is with the Rapid Resource Center, we didn't just want it available to those being released from incarceration. We wanted family members to actually be able to stop in and talk about resources and services for loved ones. So that's one of the services we offer for family members to come in, provide information for their loved ones. Our staff will go inside the jail and talk to those loved ones as well. And I'll talk a little bit about our in-reach program after I go over the data. You can see service support, hygiene. You can see the major services, bus passes and ride-share transport. Again, Melissa mentioned that our jails are not on the bus line, so that's a major request to get individuals. Well, another thing I like to notice too, that's a small window when a person gets released. They really don't want to stick around, okay? So we got a small window to try to talk to them, encourage them about resources, life-changing decisions as they go out the door. Our current Jackson Pike location is not conducive to that because of the way it was a closet that we kind of created to help us, but the new jail, we actually have meeting rooms and places like that where we can actually sit down with an individual. So you can see those services. The ride share is most important. We do, like I say, we're open 24 hours, 6 days a week, so there are third shifts. Just to make some clarity, we don't just transport anybody anywhere. We mostly use cab services. We want to make sure a person is going to a legal and safe location during the transport. So that's very important. So staff really, they'll do diligent work to make sure that's happening. Even if it's making a phone call, looking into the jail management system to make sure that individual didn't have a domestic violence charge or any type of restriction. So that's very important. Hygiene is also important. There's a high number of that, and again, IDs, birth certificates, all those things that helps a person transition back into the communities effectively. Let's see, coffees and snacks, you can see why people stop by. That's kind of our care. We want to bring a person in, but it's a need. Of course, I'm sure a lot of you haven't been in, in jail, but you know, coming from jail, you want some water or some fresh water or something decent to eat. They'll come in and they'll grab that. No knock on the sheriff's office or anything like that. So we know we can provide. So we get a lot of people in to use want snacks and also phone, charge the phone, use the phone, get in contact with loved ones, request, you know, for someone to come pick them up. And again, third shift is not, you know, those transportation opportunities we provide prevents them from having to wake up a loved one if they're released 3 or 4 o'clock in the morning, which some people, family members might not have that opportunity to pick up their loved ones. To use computers in case someone wants to do a JFS application or job application, something like that. So I don't see our JFS, but that's one of our major things. We want to make sure everyone leaving the jail have access to food stamps if they need it, SNAP benefits, as well as most important, insurance. Mm-hmm. So if they want to get linked to treatment, if they want to get mental health treatment as well as substance treatment. That's really about it, because like I say, you do have the visual of currently what we're doing, the service provided. Our future goal of the Resource Center is to increase those linkages to services, mental health, as well as substance treatment. And so what we want to do is start increasing our in-reach. So our in-reach looks like this. Did you have a question? Oh, yeah, go ahead. Probation? We do work with a probation officer, but only in the capacity as where they actually come to the facility to connect folks to like house arrest and things like that. We do receive calls from probation to actually go in, as well as parole officers, as well as social. Is that what you're looking at? You're kind of getting to. So yeah, we do have outside agencies actually call us to ask us, can we go in and visit with a client of theirs to talk about resources and stuff before they're released. So yes, we do have that relationship. Oh, I'm sorry. Yes, sir.
You're being interrupted. You probably, well, maybe you can, but there are some folks here that probably can. Why do we release inmates at 3 a.m.?
You know what? You went there. I was
question.
coming back around to that, sir. Thank you so much. As long as we still, for some reason, think that's okay to do, we wanted to provide the service, but from a policy and procedure perspective, that is something that we're working with our system stakeholders, i.e. the sheriff's office and other entities, to figure out how we mitigate and eliminate that. We understand that there's nothing good for an individual coming out of jail that would happen after hours that we would want them to even be potentially exposed to or be involved in. And so because this is something that has just been the practice, right, we want to be able to drive some type of policy and process change down the road, and we're hoping that that can happen much sooner rather than later to again, interrupt things that could potentially go wrong for an individual at that time of night.
Looks like Andy wants to weigh in over there.
In the jail environment, you have to be cognizant that this is a 24/7 operation. Let's say somebody's brother, sister, mother, mom, dad got into an argument at the holiday Christmas gathering, and they ended up getting arrested and going to jail. All right, if their bond is posted at 3 a.m., they want out of jail at 3 a.m. We're going to let them out of jail. If they have a lawful order that says they can be released, then we're going to release them. Those don't happen all the time. The majority of the releases happen during court hours or shortly after court hours. But there are some that happen all through the night. And if you have a loved one who's in that jail, you want them to be able to get released as soon as possible. Whether that's 1 o'clock in the morning and you have to arrange for transportation, or whether it's 9 a.m. and it's a lot better to get something. So we are jails, we are full service, we are 24/7. We can't schedule our release dates very cleanly. And so we have to be ready for that. But that's what makes Rapid Resource such a valuable tool, if they can get their hours expanded and have somebody there to address those needs in the middle of the night. And that's just a capacity issue.
Yeah, so we currently, as said earlier, we do have someone there awaiting them. We're there 24 hours a day, 6 days a week. I think another component to that we have talked to with our prosecutor's office and other entities in the weeds of it is, what does it look like for an individual who may be indicating homelessness coming into our jails, which we know happens quite often, right? More often than we would like to acknowledge. And the reality of it is that what does it look like? Some of the conversations that have been had is, what does it look like to have a document to where this person, from a legal perspective, if they're saying or waiving their right to be released at a certain time because of what they don't have available at 3 in the morning versus what's available at 8 in the morning. And so, as stated, the jails have a responsibility to release upon the time that those release documents come. But if an individual is given who is sound and who is able to articulate what their need may be, these are just some of the process and policy conversations that are happening, is making sure that we're not, of course, impinging upon somebody's right to be released, but what does it look like if that's something that may not be a choice they want to take at that time? So it's a heavy discussion and has been one in our county for quite some time of how can we address that.
All right. So back to, and again, you know, the wonderful part about the Resource Center, again, is the team. You know, the 3 shifts, the undetermined release numbers, you know, so it takes a team of individuals to really sit and work those shifts, really serve those individuals, figure out what happens with the person who gets out at 3 a.m., but they're, you know, have no resource or have no family, what to do with it. So I always want to give kudos to our staff to make that work. So kind of going back to InReach. I'm sorry.
And the type of team, well, just so you know, as he's talking about the team, we do utilize heavily our peer support model, which we know is a proven concept across the nation in working with the population that we serve. So our peer supporters, our reentry navigators are a huge pillar of the work that Ryan mentioned as far as just that day-to-day and walking with that person post-release.
Correct. Okay, so I just want to talk about InReach, and I'll turn it back over to Melissa. So our InReach efforts, again, we want to market, kind of advertise Resource Center, allow individuals to know the resources that are available. So one thing's, again, you know, the collaboration with the Sheriff's Office, the support we receive from them is unmeasurable. This wouldn't be possible to the effort that we present to the population if it wasn't for the Sheriff's Office. Because we do have Sheriff Office staff members who actually send people our way. They will call and say, can we come back and see someone?
Yep.
Part of our InReach is sending our staff back into the jails to meet with individuals one-on-one in their professional visit rooms. So that takes, you know, it takes time, it takes space, it takes effort from their staff. So we always want to thank the Sheriff's Office for that. But part of our InReach, we send letters. Everyone that's booked, I run a report each week. 3 times a week to allow find out how many individuals were was incarcerated. We send them letters, letting them know that there's resources available. They can also call us at the Resource Center. We have 2 lines. They can call for free to the Resource Center and request resources or ask for someone to come see them as well. Part of the future, what we want to do is start going back in, doing a little bit more transitional planning, discharge planning, as well as treatment planning, and then bring in those community resources, link those with community resources so maybe they can come in and see. Like I said, we all talked about the amount of hours individuals there at the jail, the higher percentage of those individuals. So we got to move fast. And again, that's going to take a major collaboration between the Sheriff's Office and our staff members to get that accomplished. But that's one of the major things we want to do. The new resource centers you see there's meeting rooms, there's places where individuals can actually come in, breathe, and maybe have a sit down with the individual and get them linked to service. And we want to definitely offer more of our community partner agencies, just mentioning Primary One Health, Columbus Public Health, Franklin County Public Health, we had Southeast. We have all these individuals in the beginning at the Resource Center. They're not there yet because the space is not very conducive. The releasing schedule is not very conducive, but at the new Resource Center, we hope to bring a lot of them back for those services, to provide those services to the individuals. So no more questions about that. I'll turn it back over to Melissa.
So I think you heard from both of our team members, all 3 of us. Relationships are what matter. We don't believe programs change people. We believe relationships change people. And so one of the things that I can tell you, a lot of people ask is, well, why do you think this program works? It's because of the people. It's because of the peers we bring in. It's because of the passion we require. If you don't believe people can change, you don't belong working with our office. And it's just as simple as that. You can have $1 million program, but if you don't hire the right people, you're not gonna have results.
Absolutely.
You can have a shoestring budget and hire the right people, which I think we've done.
Absolutely.
And you can have some really remarkable results. So I want to emphasize that. But something we learned very, very quickly, and you guys have all heard this, our jails are de facto mental health hospitals. Who hasn't heard that? But here's another reality. They're also our largest detox facilities, and oh, by the way, the biggest homeless shelters in our county. We can't forget those other things that are going on in addition to the mental health stuff. So we realized really quickly that, hey, if you don't have a place to put somebody so they can stop and think for a couple days about what their next steps are, you're not going to get very far. We all know about social determinants of health, and we've got to make sure people feel safe, fed, and warm before we can even ask them to think about long-term treatment,
Exactly.
getting a job, going back to school, getting their kids back. So what we did was we realized about 20% of the individuals booked into our jail book in as homeless. They are from the streets of Columbus. And we know that if they get released back to the streets of Columbus, the odds of them staying out of our jail, staying out of our hospitals, and staying out of our shelter system is very, very slim. So what we did is we created a respite program. It's called the Bridge Program. It's not long-term. It's not going to solve affordable housing crisis. And it's really a very short-term intervention. But if you come into our jail and you're booked in as homeless and you get released anytime after about 2 p.m. in the afternoon, we know it's really hard to access services. So what we offer is an individual can be transported to our Bridge Program. And it literally is a bridge. It's a bridge to where's that person going to go next. There's no requirements. They don't have to go to treatment. It happens to be at a treatment facility, so if you want to leave this wing of the program and jump over to the other wing, oh, you're automatically in residential treatment. So that is a little bit of a perk, but you don't have to do that. So you can go to the Bridge Program for 5 nights and just simply be safe, fed, and warm. And while you're there, the only thing we ask that you do is work with our peer support specialist that is there on site for a transition plan. We want you to be thinking about what's next steps. It's amazing when you're feeling safe, fed, and warm that you may think of that relative that you hadn't thought of, maybe in Indiana. Well, they have a spare bedroom. Maybe you could go there and stay with them. So all we ask is that they begin having those thoughts. One more little tidbit for you, because I told you I love data. We did an overlay, or we did a data match with the Community Shelter Board. We didn't think 5 nights was going to have a profound effect on homelessness. That's not enough time. But we thought, let's take a look at it. So we asked the Community Shelter Board to look at the 130 people that had received our respite program to see what the impact was. I couldn't believe it. Only 20% of those 130 people ended up in our homeless shelter system the 6 months after that 5-night intervention. Again, we're not solving affordable crisis in our homelessness situation,
Right.
but I do think there's something there.
Right.
So we're going to keep studying it to find out. But let me have Ryan talk to you a little bit more about what they do when individuals get transferred over to the respite
You
program.
have another slide now. So again, as Melissa mentioned, we have staff on site, and the part of the agency as well will step in on the second and third shift and as well as the weekend. So what we want individuals to do, if they're deemed homeless upon release, we want to get them there again to give them the opportunity to make that decision, that life-changing decision in a slower time. We don't want them to make a quick, let me just call a friend I know that helped me get in here to come and get me. So we want to take them there. Staff member is there during the day. We just kind of notify the facility that these individuals are on their way. They're provided 3 meals a day, 3 hot meals a day. They have shower, of course, linen. There's phone there. There's TVs in the room where they can sit and watch TV. There's a computer they can have access to as well to try to find or linkages or resources. But it's really come on our staff to make those linkages and connections for them. The stat that Melissa talked about, that only 20% of those individuals ended back in the shelter, is really a testament of the work that our staff does, and the indicator of those 5 days of really sitting down and with staff members and talking about intervention and linkages, how that helps. Sometimes it's a requirement that individuals go over 5 days. We try not to for that. We try to keep that from happening, but it does happen for good reasons. We hope that an individual, maybe their Medicaid is not in place or there's not available space to a certain treatment facility that they want to go to or something like that is the only reason. At no time is someone just sitting around 5 days. A lot of requirements is that they have to work with staff, If they're not making themselves available to staff, then unfortunately we have to try to find a different means of housing for those individuals. We request that they don't leave before they see staff the next day. There is a curfew there, and there, of course, with the other, just like most facilities, you know, they're subject to urine test, urinalysis, as well as searches and of their materials as they come back into the facility. And again, that's for the safety of the others there, as well as the facility, the treatment facility right beside it. That's pretty much all the, for the bridge program. Like I said, we was very excited. One thing, again, how that came about is we thought, okay, we're open 24 hours a day. Person gets out at 3 o'clock, they have no place to go. A lot of the community agencies are not open to 8 or 9 o'clock or even over the weekends. Now what we're gonna do with this person. So it didn't do us, it didn't serve justice to those individuals for us to be open. It was helpful, but we still had nothing to do with them. So being able to provide them a safe place to go, shower, cleaned up, have a place to, food and everything like that to their, to their access and all that was very helpful. So
Is this for men and women?
men and women,
Yes.
yes.
What about sex offenders?
Sex offenders, we do not discriminate. We do, again, that's not, the location of the facility is welcoming to those with those charges, so we don't have a problem with that. Again, so those 5 days is we have served sex offenders there. We will make note of that, and then we'll work diligently to try to get them out of there. Yes, ma'am.
How is bridge funding?
So all these programs that we're talking to you about, we seed with federal grants. We use the Justice Assistance Grant Program. We use COSAP. We use, what are some of the other big ones? We write for everything.
Yeah.
And that way, when we get the data and we prove the concept, then we go to the Board of Commissioners, who have been extremely supportive, as Director Pride has been, to really understand that we can't keep this funded with grants forever. A lot of our programs, like the Rapid Resource Center, I'd say the new one, about 80% of it will be funded with general funds. So we're pretty excited about that. We believe this program eventually, it's proving its merit. And this is actually OCJS, I just saw Lisa, this is funded through our RSAT grant. So that's another one to think about. And I think it's important for us to now do a little plug for our state partners. Not only has OCJS been extremely supportive of these programs, but other programs too that we'd love to come back and talk to you about. But OMAS, wow, between the LAI and the MAT reimbursement to the jails, that's a game changer. And when I hear there's still money left over each year, it blows my mind. So if you're not taking advantage of that reimbursement and you're a county sheriff's office, you really need to look into that, because it's a game changer, quite frankly. It's a game changer. We used to limit our MAT to 1 injection at release, but because of this funding, we now are able to give individuals multiple injections, monthly injections, and it's paying off in terms of their cravings obviously are coming down, the level of fights, overdose, all the things that come along with people who are detoxing in a jail has all been reduced. We'll be studying that too to tell you, exactly what we're seeing. But OMAS, thank you for thinking outside the box. And with your latest landlord mitigation program, that's been amazing too.
Yes.
So
and I
thank
will
you.
say, in addition to that, I believe last year was the first year that we were actually seeded with some general fund dollars because of the proof of concept that we've been able to do with many of our programs that, again, initially seeded by grants. Once that concept is proven, again, our commissioners and county administration has been uber supportive in that way. And then they made the mistake of also making me interim director of economic development and planning right now. So I'm going to find other dollars and other buckets of funding, right?
Amen.
That can transfer over, because it is eligible under certain community development block grants and home funding and the world of HUD. So we're always looking, we're always attempting to make sure that, again, we're putting our best foot forward and getting those grant dollars. We have an amazing grants management team that Melissa oversees, and that work has been huge in just us being able to get the buy-in and the other resources for funding these initiatives.